this is Dr. Barbara Oswald, and here's your Module 5 overview for PSS 312, Drugs and Behavior class. Module 5 covers medicinal drugs in our society. By the end of this module, students should be able to, at least, provide a brief overview of the history of psychotherapeutic drugs, explaining how drugs changed the way people viewed and treated mental illness. You'll have the chance to explore this further in discussion option 1 and homework question 1. Next, students will be able to explain the 4 classes of psychotherapeutic drugs and what each is designed to treat. We'll cover this in discussion options 2, 3, 4, 5, homework question 2, and the Module 5 exam. Next, students will learn to discuss the behavioral and medical differences between first-generation and second-generation antipsychotic drugs. We will cover this in discussion options 2 and 3 and homework question 3. Next, you will learn to describe the mechanism behind the therapeutic effects of fluoxetine or Prozac and other SSRIs or selective serotonin reuptake inhibitors. We'll talk about this in discussion option 4 and homework question 4. Next, you'll describe the effects of benzodiazepines on the brain and compare and contrast these effects with alcohol. This will be covered in discussion option 5, homework question 5, and the Module 5 exam. Next, we'll discuss the advantages and disadvantages of buspirone or Buspar and other non-benzodiazepines for the treatment of anxiety. This will be covered in discussion option 5, homework question 6, and the Module 5 exam. Finally, in this module, students will learn to critically evaluate the effects and risks associated with herbal treatments and over-the-counter or OTC drugs such as St. John's wort, GHB, kratom, and the inhalants. This we'll talk about in discussion options 6, 7, and 8, and homework question 7. So what should you do for Module 5? Well, in this module, we'll read 2 chapters, Chapter 13 and 14 in the assigned textbook. Then you'll read the Module 5 research article provided on Canvas. This article looks at a study on the effectiveness of buspirone or Buspar as a treatment for anxiety. Next, as with other modules, you have the opportunity to take some practice quizzes over chapters 13 and 14. You'll participate in the Module 5 discussion, you'll complete the Module 5 homework questions, and you'll complete the Module 5 exam. In this Module 5, we're talking about medicinal drugs, right? So exactly what drugs? Well, in this module, we'll talk about psychotherapeutics. Specifically, we're talking about drugs that are used to treat mental illness. These include antidepressants, antipsychotics, anti-anxiety medicines, and mood stabilizers, or drugs that are used to treat bipolar disorder. We'll also look at some prescription drugs like steroids, over-the-counter drugs or herbal treatments, or other dietary supplements, including things like kratom, GHB, melatonin, kava, St. John's wort, and also some frequently abused inhalants, including things like nitrous oxide or Whippets or Rush, butane, and gasoline. So in Chapter 5, we talk about the psychotherapeutics. We'll review the history of mental health treatment. This is a really fascinating review for anybody interested in psychology or mental health. We'll talk about what mental health treatment was like prior to the development of the first psychotherapeutic drug, chlorpromazine. So we talk about the pre-chlorpromazine era. That's talking about treatments that happened for mental health prior to 1954, and then how mental health treatment changed after the discovery of chlorpromazine from 1954 and beyond. You know, love psychotherapeutic drugs or hate them, they have absolutely revolutionized the way that people are cared for and treated in terms of relief from mental illness. So in this chapter, we'll then talk about these 4 classes of psychotherapeutics: antipsychotics, which are used to treat psychotic disorders like schizophrenia; antidepressants used for treating major depressive disorder, anxiolytics or the anti-anxiety medications that are used to treat anxiety, and then mood stabilizers that are used to treat bipolar disorder. In Chapter 14, we'll talk about other prescription and over-the-counter drugs. The book actually talks about birth control pills in this chapter. However, since I have never heard of anybody ever abusing their birth control pills, and they're not really psychoactive drugs in the way that other drugs are that we talk about in this class, we won't actually talk about birth control pills in this class, but you can certainly read about them in the book. It is very interesting. We will talk about the use and abuse of steroid drugs, though. We'll also evaluate how the the Food and Drug Administration classifies over-the-counter or OTC drugs, and why some things are allowed over-the-counter versus other things need a prescription. Then we'll talk about some herbal treatments and dietary supplements that people take for a variety of reasons, including things like to help with anxiety, like kava, to help with pain, or even opiate addiction like kratom, to help with sleep, like melatonin, to help with depression, like St. John's wort. GHB has been used since the 80s by bodybuilders as a way to build muscle mass. We also know GHB is a date rape drug, and yet it still remains available over the counter for some reason. And we'll talk about some other drugs too, and these herbal treatments and medicinal drugs. And as I mentioned earlier, we will talk about some of the commonly used inhalants. If you have any questions, as always, feel free to email me, and I look forward to learning with you in Module 5.